Welcome, everyone. I'm very happy to see you all here today, even though we're on these little Zoom boxes, soon in person, as Annie is demonstrating, by being actually live and in the flesh in Israel. So welcome to the Myers-JDC-Brookdale Committee Open Forum. I saw our president, Mark Sasiski, of course, our CEO, Ariel Zwang, on the phone. I want to welcome all the MJB committee and JDC board members and friends. And of course, our leader and executive director, Professor Michael Hartel. And I believe we're also being joined by JDC Israel Unlimited director, Efrat Stern. I hope she's on. I didn't see her yet, but she probably is in a little box. And then, of course, the members of the MJB's professional staff, without whom we could do nothing. So today, on our open forum, we're going to go on a tour of Israel's Capitol Hill, starting through the Wall Rose Garden, from the Supreme Court to the Knesset, through the government ministries, and to our renovated new building. We'll see how our research and consulting teams inform legislation, policy, and decisions in all three branches of Israel's government through the lens of improving the life of people with disabilities. To ask a question or make a comment, please click the raise hand button. We're going to have a set discussion time after the virtual tour, so I'll call on you at that point. At this stage, I'm going to turn the microphone over to Professor Michael Hartel, who will begin our program.
Thank you so much, Jody, and hello, everyone. Good morning to you, and thank you for joining us on this open forum. We are so thrilled to have Annie here with us, and we're really looking forward to having all the rest of you here with us as soon as you can. We really miss spending time with you. It's been a tough year, and we look forward to seeing you here in Jerusalem as soon as you can get here. The JDC building underwent a beautiful renovation, and the offices and the meeting rooms are filling up, and our staff is back to having priceless, spontaneous conversations and collisions around the water cooler. The weather here is amazing, and the skies are blue and they're clear. Businesses are open, cafes are bustling, and there is a palpable feeling of renewal and of promise in the air. And we'd like to share that with you. And in a few minutes, we will. Because during today's forum, we'll be demonstrating here in Jerusalem the impact of MJB's work across government and over time. We're shortly going to embark on a trip through the heart of Jerusalem. We'll visit Israel's Capitol Hill, where all three branches of government are located. We'll visit the judicial branch, Israel's Supreme Court. We'll visit the Knesset, Israel's legislative branch, and we'll pass by several government ministries, which represent the executive branch. But in addition to walking through the physical space, we're going to take a journey through time. We'll show you how the work of MJB impacts an entire area of society over decades. And we'll be demonstrating this through our work on helping people with disabilities. And today, you will travel with us from the 1990s through the 2000s and up to today. We'll see how the consistent, systematic, integrated consulting, research, and evaluations that we do across government have a very substantial and cumulative effect on the disability community. So while today's tour is about disabilities, this is really just one example of the way that we work at MJB. And by the end of this session, it should be clear just how impactful our work is on Israeli society. So to kick off our tour, I would like to call upon Dr. Leah Moran-Gilad, who heads our family research group, which includes the disabilities research team. So Leah, over to you.
Hello, everyone, and thank you, Michael, for the kind introduction. I'm very excited to be here today and talk about a brilliant concept that emerged within MJB about a year ago. As you all know, we perform research, a lot of research, and to be honest, we really adore research. But research can be difficult to explain, and not everyone relates to research, understand research, and its implication and context. So we as researchers face the dilemma of making research more accessible and interesting to a wider audience. How do we explain what do we do here at MJB? How can we explain where it all begins? How should we explain the impact and influence our work has on our government and ministries? How can we explain where we are based here in Jerusalem? I had the great pleasure of leading a group of young and talented researchers in accomplishing what they called touring MJB research. Basically, the idea was the visualization of research by placing it in the geographical and social context. These research tours makes our research accessible to various audiences and can engage almost everyone with the important topic we study while showcasing our research personnel and their notable expertise. In July 2020, we launched a series of guided research tours in the Jerusalem area. We intended to have another tool in our toolbox when we talk about research, but an especially innovative and engaging one. We succeeded in creating a model consisting of 3 different tours that can be used anytime by every researcher at our institute, that is applicable for every topic they're working on and suitable for any kind of audience. We have managed to walk, not only talk about our research. As the famous saying, a picture is worth 1,000 words, we created the magic of visualizing our research and our impact. Today, Hila Rimon Greenspan and Mariela Yabu, 2 amazing research associates from the disability team, will guide us through one of these tours. Their specific tour deals with disability, a major pillar of research, through which one could appreciate the extensive work carried out at MJB and our sustained impact. Also here with us is Lital Bar-Lev, the disability team leader, who will be happy to answer any question you may have afterwards. This is an excellent opportunity to thank Michal Aron, Nadav Ben, Irit Isaac, Hila and Mariela for their innovative, brilliant idea, and Ori Cohen, Helen Mishael, and Anat Berko-Toledano for their outstanding effort behind the scenes. Thank you and enjoy.
Terrific. Now we invite you to join us on our tour. We're going to have the star of our show, as was mentioned, are Mariela and Hila, who are recipients of the MJB's 2021 Professor Jack Habib Award for Excellence. And we're lucky to have Hila and Mariela with us today so they can answer questions after the film. So let it rip.
Shalom, I'm Hila.
And I'm Mariela. We are research associates on the disabilities team of the Family Research Group at the Myers-JDC-Brookdale Institute. We invite you to join us on a tour of Israel's Capitol Hill in Jerusalem. We will explore how perceptions, legislation, and policies regarding people with disabilities in Israel have been shaped in the last decades. We will also zoom in on how the applied research of the Myers-JDC-Brookdale Institute has helped to improve national disability policy and practice.
Our first stop is the Supreme Court. The most recent data analyzed by the MJB Institute show that over 1.5 million people in Israel are identified as people with disabilities. That's about 17% of Israelis. Their share in the general population increases with age. 9% of children, 17% of working-age adults, and 50% of old people. The percentage of people with disabilities is higher among Arabs than Jews. Until the late 1990s, the disability legislation in Israel focused primarily on issues of welfare benefits based on a discourse of need and charity rather than of human rights and equality. This legislation perpetuated the disadvantaged status of the disability community and their exclusion from all spheres of public life. Over the past 25 years, we have witnessed significant changes in legislation and policy, as well as greater inclusion of people with disabilities in society. To a large extent, these changes are due to legal advocacy and community activism. In 1993, the Bizchut organization, the Human Rights Center for People with Disabilities, filed a petition to the Supreme Court on behalf of Shachar Botzer, a 13-year-old boy who uses a wheelchair. The petition demanded that Shachar's local municipality make public buildings accessible, especially his school. The Supreme Court accepted the petition and in a presidential ruling determined that the rights of people with disabilities are basic human rights anchored in the principle of equality. For the first time, accessibility was acknowledged as an essential right and a means to guarantee equality and inclusion in society. Following the Supreme Court ruling, Bizchut promoted legislation to ensure equality and inclusion and to prevent discrimination. After a long struggle, the Equal Rights for Persons with Disabilities law was passed in 1998. The law frames issues of people with disabilities as issues of basic human rights.
MJB prepared a report on the inclusion of people with disabilities for the Ministry of Justice, the ministry in charge of the implementation and enforcement of the Equal Rights Law. According to the leading principle in the disability community of nothing about us without us, we make every effort to involve people with disabilities in our studies. Accordingly, we reach out to members in the disability community to hear firsthand what they think. We conducted focus groups, interviews, and consultations with an advisory committee of people with disabilities. The input helped us identify the main issues faced by people with disabilities, which we later included in the study questionnaire.
A few years after the Equal Rights Law was enacted, large demonstrations took place, protesting policy which limited the integration of people with disabilities into the labor market and left many in the disability community unemployed and poor. In response, the government established a national commission to examine and address the problem. The goal was to increase the income of disability benefit recipients through both benefits and employment. The Commission's recommendations led to the amendment of the National Insurance Law in 2009.
MJB was commissioned by the National Insurance Institute to conduct two studies. The first study was conducted at the time of the amendment, provided a thorough mapping of working age people with disabilities for the first time in Israel. We found that the employment rate among general disability benefit recipients was 25%. The second study was commissioned to evaluate why the amendment failed to significantly increase employment rates among people with disabilities. One interesting finding was that people with learning disabilities had difficulty integrating into the labor market. Their disabilities are considered mild, so they were entitled to very few benefits. We found that with a few additional benefits and support, their integration into employment can be successful. Let's continue to the second stop on our tour. We will pass through the Vivian and Maurice War Rose Garden and stop at the Knesset.
The change in perceptions about people with disabilities led to new legislation in Israel and new disability policies. Another milestone is the 2006 UN Convention on the Rights of Persons with Disabilities, which Israel ratified in 2012. The convention inspired Israel's groundbreaking amendment in 2016 to the Legal Capacity and Guardianship Law, allowing supported decision-making as an alternative to guardianship and positioning Israel as a world pioneer in disability rights. The Institute was commissioned to conduct a study for the Ministry of Justice to review the new procedures for supported decision-making, define best practice, and help the ministry develop a monitoring mechanism.
In a 2017 policy reform, the Ministry of Labor, Social Affairs, and Social Services set up a Disabilities Administration, adopting an emerging approach known as Person-Centered Service Provision. This means instead of providing services based on a person's disability, people are provided personalized services according to their needs, capacities, and preferences. At MJB, we examine the implementation of the person-centered service approach at both the macro and the micro levels. At the macro level, we conducted a formative evaluation of the perceived systemic changes implemented by the administration. At the micro level, we conducted a formative evaluation of a personal budget pilot program. Each of the program participants designs a personal plan with the support of a case manager and receives a budget to implement their plan. Although it is a small-scale pilot program, it has far-reaching implications for the national scale-up of person-centered service provision.
Now on to the last stop of our tour, the JDC building, home to the Myers-JDC-Brookdale Institute, situated here on Capitol Hill, a stone's throw from the Supreme Court and the Knesset, as well as major government ministries. At MJB, applied social research on disabilities means using rigorous research and extensive knowledge to help improve decisions that impact well-being of people with disabilities in Israel. We use our research to help inform legislation and policy, advise programming, and improve services for individuals, families, and the disability community. To this end, the disabilities team at the Institute conducts 4 main types of applied research. The first involves thorough mapping. Some of our studies are designed to map services and policies. Other studies map needs emerging from the field. For example, how does the government decide how to best allocate resources for children with disabilities? The only national survey about the needs of these children and their families was conducted over 25 years ago by MJB. In order to equip decision makers with up-to-date data, we initiated a large-scale survey of needs and service usage among parents of children with disabilities.
Secondly, we conduct evaluations of innovative programs, specifically programs that can help shape national policy. An apt example is our evaluation of the personal budgeting pilot program that we mentioned earlier. The goal in this case is to conduct a formative evaluation to shape the program and to help in its national scale-up.
Thirdly, we conduct evaluations of national policies and programs. These studies are designed to identify what works, what doesn't, and why, to ascertain service usage, and more. For instance, a national reform moved responsibility for the provision of mental health services from the Ministry of Health to Israel's Healthcare Fund. We conducted a study ascertaining the current state of mental health service usage by clients at the onset of the reform. 6 years later, we are now conducting a follow-up study to see the impact of the reform thus far.
Finally, we conduct international literature and policy reviews. At the outset of the COVID-19 pandemic, the Ministry of Education commissioned a rapid response international review of special education policies during COVID. A report presented the responses to the crisis of education systems in several selected countries. From school lockdown and distance learning to providing education and care needs for children at their homes and more. In this way, applied research can inform policymakers about what is being done in other countries and facilitate an adaptation of relevant solutions.
Our tour began at the Supreme Court, continued to the Knesset by way of government ministries, and ended at the Myers-JDC-Brookdale Institute. We followed changes in perceptions, legislation, policy, programs, and services for people with disabilities in Israel over time. We demonstrated how our applied social research has informed and equipped decision makers along the way, and how it helps improve the well-being of people with disabilities in Israel.
Thank you for joining our tour today, and thank you for your ongoing support of the work that we do.
Thank you so much to Hila and to Mariela. And the work is amazing. And being here in Jerusalem, so close to Capitol Hill, literally looking out this window and seeing those places that we just saw is so important. So welcome back from Capitol Hill. And I hope that you enjoyed our visit right across the street. I hope that we had a taste of the impact of our work across all the branches of government over time. We saw how the consulting, the research, and the evaluations that we do across government agencies and spanning decades have had a substantial cumulative effect on the disability community. We heard examples of how the work of MJB has impacted one area of society over decades through our work on behalf of people with disabilities. But while today's tour focused on disabilities, this is just one example of the way that we work at MJB and the ways in which we help improve policies, programs, and services for the well-being of all Israelis. Back to you, Jody.
What a marvelous example of the integrated way in which we work and impact all of Israeli society. Thank you so much, Hila and Mariela and the entire team. I was struck during the film with a question, so maybe I'll go first, and then maybe I'll ask if those who were in the audience. And I'm not sure if I can see people's questions because I'm not a host, but we'll figure that out in a minute. But let me ask my question first. Can you explain to us, Michael and team, really, Leah, Lital in particular, how MJB collaborates with JDC Israel Unlimited? Because obviously Israel Unlimited is an important tool of JDC's to work in this area, and the work is obviously synergistic, but could you kind of expand on how and when and how you work together?
So Lital, can you take that question maybe?
Shalom everyone. I want to start by saying that we consider JDC Israel Unlimited to be not only our client, but also our colleagues and partner in the advancing knowledge and services for people with disability. We appreciate the professionalism of Efrat Stern and her team and their ability to apply our research finding in their work. They listen carefully to our finding and use the knowledge to take action. We are currently preparing this year's statistical report on people with disability for JDC Israel Unlimited. We integrating data from various sources. The report is a unique document that provides an up-to-date picture of people with disabilities in Israel in different fields of life. We also conduct evaluation of JDC Israel Unlimited program. For example, the Smart Home program and the Personal Budgeting program. JDC Israel Unlimited also regularly consult with our researchers as experts in the field. Efrat Stern, the director of JDC Israel Unlimited, is here with us today, and she will be able to tell you more about our collaboration from her point of view.
Hi, everyone. Thank you, Lital. So first of all, thank you for inviting me here to your very important meeting. And I agree with all what Lital just said on our collaboration and the researchers that we're doing together. JDC Israel Unlimited has a long-standing professional partnership with the Myers-JDC-Brookdale Institute, which has over the years conducted a significant number of evaluation for the department. Each evaluation was done in close collaboration with our team, included in-depth discussions about the challenges that might be faced along the way and the significance of the research results. Our work together has increased our professionalism, helped us build better models and fine-tune best practices. Lital and Michael Hartel is sitting in various Israel Unlimited committees and provide an important research perspective that has proven as added value to our work. Unfortunately, in Israel, there is no centralized or systematic collection of data or even unified measurements tools regarding people with disabilities. This makes it very difficult for us to identify changes and trends within the sector and leads to a reality in which there are many organizations focusing on improving the lives of people with disabilities, but with no way to measure their impact. Unifying impact indicators have not been national priority in this field, and there has been significant decentralizations among service providers in this realm. This is why, together with Brookdale, Israel Unlimited began mapping strategic quantitative and quantitative indicators with which to measure impact, particularly in the field of increasing the level of independence of people with disabilities and reducing gaps in opportunities between them and people without disabilities. The indicators also take into account the great heterogeneity among people with disability. In this context, Brookdale has been a vital source of information and knowledge. You helped us pull existing information and better understand the existing data in order to formulate impact measures and set feasible goals for success according to national and international benchmarks. Our work together has helped Israel Unlimited make strong data-driven strategic decisions, and I'm very, very grateful. All of our team are very, very grateful for our ongoing collaboration.
Thank you so much, Efrat, and thank you for all the wonderful work you do. I have to say that the synergy and the partnership between MJB and Israel, JDC Israel, is really a powerful tool, and it brings even more to Israel than either individually could bring. So we're very lucky to have the combination. At this point, I'm happy to take questions from the audience. I don't know that I can see, Carrie, the raised hands, and I think you can, if there are any, or if anybody has a question, and if not, I have a couple that I got on the chat, but Ariel has a comment, so.
Yes, I have a comment and a million questions. My comment is just what a beautiful idea it was to do this, and what an engaging way of bringing us into the intellectual topic of research. I loved seeing how studies had led, for example, to policy changes like the difference between services being related to diagnosis as opposed to person-centered services and what this individual needs. That's magnificent. Are you able to share other examples, either in the disability field or it might be in other fields as well, about how, as a result of these research findings, there have been actual real-world policy implementation differences that really affect people's day-to-day lives in that way?
Thank you. So thank you, Ariel, for the question. And I'm going to ask Bruce Rosen if you can maybe help us out with this one. Bruce Rosen is the head of our systems research group and has been with the Institute for, I don't know, well over 30 years. His field is in health, and that's something that's actually unique to Brookdale and something that we don't see elsewhere in JDC's work in Israel. So maybe to sort of balance out, Bruce, and maybe give us one of the examples of your many years of experience where something that we've done has directly impacted a policy decision in Israel.
Sure, Michael. Thanks for this opportunity. Israel has an excellent healthcare system and has universal coverage. But we also have problems. And one of the problems is that the doctors and the nurses most of them want to live in the center of the country. And we have a lot of people with important needs in the Galilee and in the Negev, and there aren't enough doctors there. So the government realized they had to do something and put into place financial incentives to encourage more doctors to go to the periphery. They weren't sure whether it would work, so they asked us to check it. And we checked it, and we found that it worked partly. it worked for certain groups of doctors and not others. It worked in certain ways, not others. It was particularly good for pulling in doctors who had grown up in the Negev to stay in the Negev as opposed to migrating to the big city in the center. And as a result of that, they tweaked their program. They realized it was important to keep it going, but to do it better, to get more bang for the buck, and to build it in a way that particularly focused on physicians, Arab and Jewish physicians in the north and the south, and to also make sure you don't just do it for the youngest physicians. You need to also reinforce that with a cadre of more senior physicians who make a career of staying in those areas and being an attraction and being the leading lights for the younger people.
Terrific. It's really impactful, and probably we could use that here too, because we have a problem with doctors in rural hospitals for sure in the United States. There was another question in the Q&A, which was, what are the key challenges regarding disabilities, switching back to disabilities, that Leah and Lital, you think the Israeli government should be tackling in the next couple of years? And what ways can MJB help the government tackle those issues?
Hi again. I want to start by saying that our team conducts research on the key issues in the field of disability today. I would like to mention a few of these key issues. First of all, the most important issue are increasing the independence of people with disabilities and the social participation. Employment and community housing are the most urgent issues, but also accessibility and education are important. There are huge disparities in Israel between people with and without disabilities in many fields, but especially employment, education, and digital literacy. We see it in our research, and we also saw it very clearly during the pandemic. Loneliness of people with disability is a global issue and has been for years. But the pandemic and the lockdown amplified the experience of loneliness and social isolation for people with disabilities. I think that after the pandemic, Israel simply must address this issue. Another global trend that we also face here in Israel is the aging of people with disability. This is a new phenomenon of the recent years, and Israel is not fully prepared to face it. We have to think about the needs of the aging people with disability and what service we have to develop and provide in terms of housing, healthcare, and more.
So what do you think what'll be on your plate to help the government there? Are you pitching something in particular, or are you waiting? Do you wait for them to come up with ideas, or how does that work?
I think we do both. Some research topics we initiate because we think they're urgent needs to be addressed, or they're emerging and we have to address them. Other topics, other research topics we are asked to do by the government. So I think we do both. I think the pandemic, but even before the pandemic, one of the issues that we have to address and the government has to address is technology, assistive technology, but also digital literacy, which was really apparent in the pandemic that there's a huge gap between people with and without disabilities in this term. And I think, and we are actually writing a research proposal now to address the issue.
And obviously the pandemic would have demonstrated this in part, but I think, and Bruce noted it also, the differences between the center and the periphery, and the impact of being disabled in the periphery versus the center. Have you guys thought about that? Is it something that you look at?
We didn't research that directly, but I think it will be apparent. We're actually finalizing a huge survey about children with disabilities, which is a national survey. And I think this issue will come up but we did not research that directly. But that's definitely something to think about for the future.
Yes, for sure. Leslie Dunn was wondering if you could talk a little bit about the differences between attitudes toward disability in the Arab community and in the Jewish community in Israel, and whether that impacts your research and how.
We conducting research about children with disability at the Bedouin community. And we saw that children use less services at the Bedouin community. And we try to understand why. And it's really interesting to see what's happened there, because it's very simple to say there is not enough services, so please open more. But we saw that the parents don't like to send their little children to the kindergarten, not daycare, for daycare, because they think that the child should stay with his mother. The government should do something to convince the parents that it's very important that the child will go to the daycare, because it's not only babysitter. And just after the parents will understand it, it's a good idea to open a new daycare, because if they will open daycare now, no one will come, they will close it. And we say, there is no need.
We tried. Yeah. There's a question about how and to what extent the IDF deals with people with disabilities.
Yes, maybe I should first say that some people come out of the army as people with disabilities. So yes. There is a department within the IDF that is specifically serves people with disabilities because of their service. And you can see some differences between quote unquote regular people with disabilities compared to vets. So that's one thing. The IDF is definitely one of, when we look at social participation of people with disabilities in Israel specifically, serving in the IDF is definitely one of the markers of being part of society, not only for people with disability in general. It was always true, it's somewhat less true, but it's definitely part of society, or the Israeli culture. And there are programs that accept people with disabilities for the IDF or a national service, which is another national program. There's a specific program for people with autism, but also people with cognitive disabilities, with physical disabilities. So definitely the IDF, people with disabilities serve in this way or another at the IDF.
Terrific. And can you talk a little bit about the challenges and the opportunities in the employment field for persons with disabilities?
That's a big question.
Yeah.
Yes, actually, we were asked by the Ministry of Social Affairs to conduct a literature review, international literature review, to examine how people who became disabled during their adult life and were employed, how they, if and how they're encouraged to return to employment. And specifically what the ministry asked us to look at, how we encourage employers to employ back those people who became disabled. So that is going to be really, really interesting and challenging, but really interesting. And we definitely anticipate that the ministry will take the research findings and actually implement them as part of their policy. So that's one thing we do.
That'll be a window into, I guess, mostly physical disabilities, although not obviously all. Terrific. Wonderful. Thank you. Anyone? Yes.
Yeah, I'd like to just make another comment.
Please.
Thanks. You know, the idea, I guess, behind today's open forum was how do we make research more approachable? And also, how can we show the impact of the work that we do here at Brookdale? So on the one hand, we use this type of framing that Leah talked about before we saw the movie, of showing the research in the geographic space where it actually takes place and where it has its effect. As Leah mentioned, we've done this type of structuring of having a walking tour for additional fields, one on poverty, one on affordable housing. And this is now going to be an open invitation. We hope that as the skies open up and as people feel more comfortable and as travel improves, when you come to visit here in Jerusalem, we'd be more than happy to conduct more of these tours actually out in the field and to walk around and sort of learn the research through our feet. The other point is that we had a little bit of help in making research more approachable and available to people through the COVID pandemic. Data is king. People now understand, what the R is, the reproduction rate, and looking at rates and looking at new numbers and looking at, doubling times and looking at, serological surveys and positive PCR results, stuff that a year and a half ago, the population really didn't know a whole lot about. Using data to look at, outbreaks, looking at data state to state in the US, now, with vaccination coming around, it really gave a boost to everything that's data driven. And so, we hope that this is opening a new window for people to really understand the power of data and really understanding the leverage. So if you look at Brookdale and what we do, you can think of us as ELI, right? We do evidence, leverage, and impact. So that we look around, we say, where's evidence? What can we find? What numbers can we vacuum up? Who can we talk to? What literature can we search? Which other countries can we ask? What information is out there? And how can we suck that information up and analyze it? And the next is working with strong partners, in this case, the government. That's the big dog in the arena. How can we leverage that evidence and change a policy, change a program, improve a service? And finally is impact, because when we work on the national level, every incremental change that we make can impact on tens of thousands of people, hundreds of thousands of people. It can be millions of people in certain cases when we're talking about universal benefits like healthcare. So hopefully it's a window of opportunity where we can talk a little more freely about the work that we do, and maybe people, we hope, will be more open and engaged to understanding the impact of data and how that works too.
Numbers are not boring. Does the Ruderman Family Foundation, Karen Moss asks, use our work in the development and implementation of their programs for the disabled and for the IDF?
Okay, so Ruderman, as you all know, they were really big and are still big partners of ours in JDC Israel Unlimited. The researchers that we did together with the researchers on our programs. We decided to which programs we should develop together with them on the base of the data that we got from Brookdale and from our and from what we're doing in the field. So this is what they're doing with us. I think that when we, not just researchers, I think that when we went together to learn in the field with Brookdale or in the things that we did in our programs, I think they, and of course that they are sitting in our committees, in our professional committee, in our board of Israel Unlimited. So this was the way that we studied together with them and with Brookdale what are the main issues that we have to deal with. So I think this is the sources where they had their information. I'm not really sure what were their other resources for their activities outside Israel, but I know that inside Israel we decided together, but from what we know from our partners, I have to say that our partners from the government, from the different ministries, our partners from the municipalities, and maybe most important, people with disabilities that are part of our committees. They gave us the most significant data and knowledge where we should be active.
That makes sense. Terrific. Thank you, Efrat. Appreciate it. I don't, Michael, see any other questions. So if you want to wrap us up, that would be great. Let me thank everyone, particularly Lital, Hila, Mariella, and the team in the Family Research Group. Also, thank you, Bruce, for your cameo. And of course, thank you to our JDC leadership team and to Professor Hartel and his team. I think that the work that JDC in Israel has done with the disabilities community is amazing. And I think that the impact of what seems intellectually to be very intellectual brain work that JDC Myers-Brookdale has done and will do cannot be underestimated in terms of its ability to help government in very tight and stretched times, an under-resourced government, do things more efficiently, more effectively, and have more impact for the people who need the services so badly. So I think the combination of what we have going on in Israel is so powerful, and we should be, I think, as JDC board members and as JDC fans, very proud of the work that JDC does in Israel, and the combination of Myers and JDC Israel is really powerful. So this was one example of that. There are many others, and I really appreciate everyone's time and attention. Thank you. Michael, did you want to add anything?
So I just wanted to say thank you again to our president, Mark Sasiski, for being on our call today, and to our CEO, Ariel Zwang. We really appreciate your taking out the time to be here with us today. I want to thank Efrat Stern for being here on the call with us. I know that you're really, really busy and that you have a busy week ahead of you as well. But it's really demonstrative of the partnership and the way that Myers-JDC-Brookdale and JDC Israel complement each other in the work that we do, and how we sit on the same continuum of tackling social problems here in Israel. The example today was disabilities. We could say the same thing for Eshel and for Ashalim and for Tevet, where we sit on that same continuum and look, from identifying the needs through the policies, through implementing the pilot programs, evaluating them, translating them into national policy and programming. It's really just an excellent example of how all the different parts work together. And so thank you, Efrat, for being with us here. And of course, to all of our JDC board members and our MJB committee members, thank you so much for being with us. We love it when you're here with us. We miss you a lot, and we hope that we can see you here soon. Take care, everyone.
As long as I'm sitting here, I'd like to thank the MJB team and family research team today, because they hosted me. And what I learned, or what has been reinforced, is that MJB's work informs every single aspect of JDC Israel's work. And without their research and their in-depth relationship and policy ability with the government to make change, it's, I don't know how you get anything done in this country. So, so thank you. Thanks for hosting me. And I look forward to seeing everybody on the next MJB call. Jody, great meeting. Thank you.
Thanks, Jody.
Thank you.